studying. Yeah, I stayed up so late studying and I didn't really have time to get ready. So I just
And
decided to use
Luna,
my
will you
audio.
stop?
I couldn't hear what you just said. Could you
I
repeat
said, will
it?
you please stop? You wake up looking good.
Thank you. But yeah, I promise the next time that we talk, I will put my video on.
Okay, I mean, like this photograph here looks like out of page of a model's book. You know what I'm saying?
Yeah, this is my profile picture on Facebook and a lot of different things. So I made it. I guess it's just the best version of me I'm trying to portray in my pictures. Yeah.
Okay. I saw you had this. You drew a flower the other day.
Yes, I did. I was like I had a break between my classes, and I decided to just draw one of the pictures that I took because I take a lot of pictures. So I took some pictures of flowers in the past year, and I just decided to draw one of them because I had some free time. So it was nice, and I discovered that I still have the talent of drawing, even though it's been years since I've actually
Oh,
drawn.
okay, yeah. But by the way, ladies and gentlemen, in case you want to know, this is Dr. Lubna Kabir. She's a doctor in training, and she's just into her first semester of medical school. And we here on Conscious Raising Art are allowing, well, she's going to allow us to find out what it's like being in med school, what she's going through. All
Mhm.
right. So Lubna, what is it like going and being in med school?
It's a lot of work. It's very challenging. Like everything is super fast paced. So we have like a lot of exams. I've had at least 2 exams every week since the start of classes, basically. Like in the first few weeks, there was just like 1 exam per week, but now we have 2 exams per week. And we started right away. So my first exam was like a few days after my first day of classes.
Really? Wow.
Yes.
Yeah.
And it's a lot of studying, and it's like every exam covers the same amount of material that would be covered in like half a semester of college.
Oh my goodness.
Yeah,
Okay.
it's always like every exam is about 10 lectures. It covers 10 lectures with like 50 slides per lecture, and then
Hmm.
each of the slides has like a whole bunch of information that you have to like learn and memorize. It's a lot of work, but I try to take it easy, and I know like it's not like undergrad where I was trying to get the best grades possible. In medical school, I'm just trying to pass. Like I'm okay with just passing my classes because that's how it is, pass or fail.
Oh, okay. Okay.
Hmm.
Right. No sense breaking your brain, right?
Right, right. And if you pass all your classes, then you're still going to be a doctor. So even if you
Well,
like
yeah,
are
right.
on the borderline. Hmm.
Yeah. That's cool. I mean, so you're having fun now?
Yes, I'm having fun. I made a lot of like really cool friends, and I'm still
Oh,
like waiting to like find people who are like interested in the same things as me outside of medicine, because as you know, I love like nature, art, photography, and exploring, like going around and driving around and exploring the like nature and different places. Yeah, I haven't found anybody like that because a lot of my classmates are just like after class they just go home and study, or they study in groups. Um, well, obviously we don't have much free time, but I hope that I find somebody who has the same interests as me outside of medicine.
yeah. That'd be a nice experience. But while you're in medicine, there's a song
Hmm.
by Cosby, Stills, and Nash, I believe. It
Hmm.
goes something like this: If you can't love, so, oh yeah, if you're not with the one you love the one you're with.
Hmm.
So that means like if you can't find the people outside who are grooving on your frequency, then hang
Hmm.
out with the guys that you know, and it'll work out there too.
Yeah, yeah, exactly. I totally agree. It's like you love what you have, like make the most of what you have kind
Yeah,
of thing, right? Yeah.
exactly.
Hmm.
That's the point. Right, right.
Hmm.
And I've been getting into this new concept about staying in the middle lane.
Hmm.
Like life is a 3-lane highway, right?
Hmm.
Past, present, and future.
Hmm.
You ever see that movie Kung Fu Panda?
Yeah, I saw it a while ago. I was very young, much younger when I saw it, but yeah, I've seen it.
But remember when Uguay says, he says, the past is a history,
Hmm.
the future is a mystery.
And the present is a gift.
Yes, there you go.
Yeah, I remember that very clearly. Hmm.
Right. You know, but the question is, how many of us are living that way?
Hmm. Right. It's yeah, it's crazy. Like actually, I've observed this even in medical school. Like a lot of people are always future oriented and
Hmm, hmm.
or like stuck in the past. Like if they failed an exam or like got a bad grade or something. They're always thinking ahead or thinking about what they've done, and it's hard to live in the present moment, but I've been doing my best and I'm like really happy here. Like just living in the present moment and not worrying more than I have to, basically.
Well, yeah, I
uh,
mean, I understand it's a lot of pressure, you know.
yeah,
It's true. So
but
yeah,
yeah. Mhm.
living in the moment is quite a challenge.
It is, yeah, but it feels good, and like it's important because if you don't live in the moment, then your whole life will pass you by. Like you're always gonna miss the moment, just
Right.
thinking about the future all the time.
You know, that's what you know, with Serena Williams, with Serena, right?
Hmm.
Serena,
Hmm.
she was another tennis player said that he was playing doubles with her, and
Hmm.
he had made a mistake. He made an error. He was still dwelling on it,
Hmm.
but she had forgotten all about it. She was ready, you know, she's in the game, ready to play the next move. You know,
Hmm.
that's the classic case of living in the moment. You know what I mean?
Yeah, exactly. Like you can't really change the past by thinking about it more.
Yeah,
Yeah. Hmm.
but for some reason, oh man, I made a mistake. You know,
Hmm. Yeah, I have a really good example of this actually. Like in medical school, like a couple weeks ago, we had a lab. Like in the morning, I had to go there and I had to be there by 8 o'clock. But I got there by 8:05 because I was just trying to find parking. It's really tough, like with all the schools we have, all the programs we have in our school, like it's hard to find parking. So I got to the lab by 8:05, and then the instructor marked me like tardy for being 5 minutes late, and it made me feel so bad, and I was dwelling on that the whole lab and the whole
right,
day, and I
right.
couldn't concentrate. And I realized like there would have been nothing, like just thinking about it all of that, like all that much didn't really change anything. It just made me do worse, like throughout the
Yeah,
rest of the day.
because
Mhm.
you're beating yourself up over 5 minutes, right?
Yeah, exactly. And I should have just let it go. But like, yeah, that's something that a lot of us need to work on. But yeah, even I need to work on that. Hmm.
Well, how do you let it go? What's your technique? What's your process?
Like I talk about it or think about it a little, like I allow myself to think about it a little bit, or like let it out through like writing about it or telling a friend about it, which is what I did. I told my friends like, oh, I hate that instructor. She just made me 5 minutes. She marked me tardy for being 5 minutes and took points off. And then I let it go after like I let it out. Mhm.
Oh, poor baby. You hate that instructor. Oh man.
Yeah, I was very mad that day. Maybe I was just under a lot of stress from like exams and stuff.
It
But
could be, but I'm
mhm.
sure you won't be late again, right?
Yeah, yeah, for sure. And yeah, I'll leave earlier so that I can find parking next
Yes,
time.
right.
Hmm.
Yes. Well, that was the lesson you learned, right?
Yeah, we all learn lessons from like the mistakes we make. Hmm.
Well, some of us do, some of us don't.
Right. It can go either way. Hmm.
Yeah. I mean, you have a learning opportunity. The question is, will you take advantage of it?
Right. Hmm.
So what else you been doing besides cracking the books?
Um, I have been let's see. Oh yeah, I was gonna also mention like we have lectures every single day, like back to back. We have at least like four anatomy lectures and four biochemistry lectures every day, like on average. And
Whoa.
it's like a whole day full of sitting in the lecture hall. But like a lot of my classmates, I've figured that I'm more efficient like studying on my own as opposed to going to the lecture. So I mean, I feel I kind of feel ashamed to admit this, but I also don't. But I don't go to all of the lectures. I like sometimes I stay at home and study on my own and like review the slides on my own so that because sometimes the lectures go too fast and I can't really, I get lost and I end up wasting time because I'm just sitting there. So yeah, that's what I've been doing. I've been studying from home, like or in the library a lot.
Well,
Just
that's
lectures. Mhm.
interesting. So for you, it's better to do it on your own as opposed to being at the lab, at the lecture.
Yes, like a lot of medical students do this because like the lecture in medical school, like it's a lot of material and they go so fast. So you within one lecture, you can't really understand everything. You're gonna have
Mhm.
to go over it on your own again anyway. And for me, it just like I like to absorb things very slowly. So I listen to the recordings and like I pause it and then I
Oh
go through
yeah, I
the
see.
slides.
Okay. So the recording's online, is that what it is?
Yeah, all of the lectures are recorded and available online.
Oh, so that means you can just kick around in your night clothes, just studying, right?
Yeah, that's what a lot of people do. Of course, I go to the library. I feel more disciplined when I just go, like I'm
Yeah,
just present on campus. Yeah,
right. At least you're at school, right?
yeah, exactly.
Oh, that's good. And so, like, do you guys get any holidays or anything?
We did get Labor Day off, and we don't really get weekends off because we still have to study. We have exams like almost every Monday. So we have to study all weekend long. So my weekends are never free. But I do have a break after, like our system is like this. We have 3 quarters. Well, there's also a summer quarter, but we don't have classes in the summer. But we have 3 quarters, which is the fall, winter, and spring quarter. And it's not a semester system. So after each quarter, we have about a week or a week and a half off. So
Really?
yeah. So I have a break at the end of October, which is when my first quarter ends.
Oh, okay. So what are you gonna do? I know. I know. You're gonna go back to nature, right?
Yeah, I'll probably go back to nature or I might like go somewhere that I really love, like New York. That's where I always go when when I have a break.
Oh, yeah.
Yeah.
Okay. Well, it could take you longer than a week to New York.
Yeah. Well, whenever I go there for about a week or 2 weeks. So like yeah, I have so many friends over there and I have like basically I lived there for 6 years. So I have an entire part of my life over there and
Right. Well,
yeah.
it's right across the river from where I live in Newark.
In Jersey, New
Yeah,
Jersey.
yeah.
Yeah.
Enjoy.
Yeah,
You lived in New York. I live in New Jersey.
yeah, I actually do. I have some friends who live in Jersey City, and
Oh, okay.
I stayed with someone in Jersey City, like one of the times that I went to New York. So it's really
Hmm.
nice.
Yeah, the new part of Jersey City is very nice by the seaport.
Yeah, it is. And I really like Hoboken as well. Hoboken is very like hip and new, and they have a
Yeah,
lot of stuff going
yeah.
on.
It's not quite. It's not the village, but it has that village feel to it.
Yeah, exactly. And I might even fly into Newark Airport because sometimes the it's easier to find flights going to Newark than to
Yeah,
southern.
because even getting to New York from Newark is easier than going from LaGuardia or JFK.
Yeah, yeah, for sure. I mean, either one is good, but JFK is my favorite airport in terms of like the atmosphere. It's just very big, and I really like that airport.
I when I was I used to travel to Indonesia a lot, and I had to go through Singapore.
Hmm.
Singapore International Airport is quite impressive.
Hmm.
Yeah,
Yeah,
have you been there?
when I was younger, my family's from Bangladesh, so we used to go to Bangladesh. Like we used to use Singapore Airlines, and
Oh yes,
always stopped at the Singapore airport. And I agree, it was very nice.
yeah, and Singapore Airlines. My goodness, they treat you like royalty, right?
Yeah, yeah, definitely. And I've also been to Thailand because I used like I forgot which airway is with Thailand.
It's Thai Air.
Thai Air, yeah. So I I've stopped at Thailand, and also I think Singapore Airlines once stopped at Osaka, Japan.
Oh, really?
So I've been there. But those are when I was very young. I want to actually go and travel to those places, like not just for a layover, but like actually travel there and see those places.
Well, being a doctor, you can go anywhere.
Yeah, that's very true. I hope so. One
You know,
day
I,
I will.
I'm a doctor. Oh, come on in. No problem. We need you.
Yeah, I actually discovered what kind of doctor I'd like to be as well.
What's that?
Um, I want to be a psychiatrist because I have a background in psychology. I majored in psychology, and that's my favorite class right now because we have a human behavior class um, that we have to take, and it's like very like the concepts are easy for me, and I really enjoy them, and I'm interested in them. And I don't really like touching people because, like, for the other specialties, you have to get involved, especially surgery. You have to go into the body and like fix things. I just like treating people from afar without like touching them. So that's why I would prefer to be a psychiatrist.
Okay.
Mhm.
But how's that tie into your holistic approach, though? How does that work?
Well, I talked to my mom about this, and I discussed how, like, at the basis of almost every like chronic illness, like especially like I guess obesity, cardiac um, problems, and things like that, um, heart disease. Those things are based on like a person's psychology. Like that's where it all starts. Like if you're depressed or anxious, or if you're not thinking the right way, you're going to make choices that affect your health. Like you're going to eat the wrong foods, you're going to be like have bad sleeping habits, things like that. So a lot of like physical problems stem from psychological problems. And so I want to go back to the psychological parts and help treat those in people who need that help. Yeah.
Would that be more preventive or actually like curative on the scene after they get it?
Both. It can be both. I believe I did study public health, so I know a lot about like preventative medicine. And yeah, for like chronic illnesses, I believe that like treating psychological illnesses can really have a like prevent a person from having a heart attack or getting a stroke or having diabetes if they have pre-diabetes. So it's just like preventative in that way, but it can also be beneficial like for people who have poor health already. Like we can reverse that by treating something about their psychology, like helping them improve their self-esteem or helping them with like life issues. Yeah.
So if a person is pre-diabetic,
Hmm.
what would be your RX for that?
A pre-diabetic person eats I mean that's like if you eat too many carbs or if your diet is not good. So you would like go and check if that person has like depression or anxiety or even like I don't know. I can't really think of all of the disorders right now, but there are a lot of disorders that are correlated with like diabetes and obesity and things like that. So you would treat those first. And as a psychiatrist, like you also have the power to prescribe medications. So you would, if they need something like antidepressants or anxiolytic drugs, then you would do that, I guess. But obviously, I'm not an expert and I still have a lot left to learn.
Well, yeah, so that's like, so you do your regular 4 years in medical school, right?
Yeah.
Then how many years after that?
Then, like, whatever specialty you decide to go into, you have a residency. So, like, a lot of residencies, most of them are about 4 years long. So, I would go into residency for 4 years in a psychiatry program at like any university or hospital. Like, my goal is to do psychiatry at Columbia University because
Yeah, good post, right?
yeah, that's my dream because I went there and I went to Columbia and I'm familiar with the psychiatry and neurology departments because I used to
Oh,
work there when I was in not high school, college. So I would love to like go back and live in New York again. That's my dream.
Hmm. Yeah, well, they have other choices. They got Bellevue.
Yeah, and NYU, and there's a lot of interesting patients who come in New York. I think because that would be a good place for me to do my residency, so I can learn a lot more. Since New York, it has such a diverse population, and a lot of mental health care is needed for like that population.
So now, how do you balance this, say, dispensing medications
Hmm.
with your natural organic approach to life?
Yeah, like this is something that's been debated a lot. Like, you know how psychologists only do talk therapy, but psychiatrists do they can do therapy like psychotherapy and also prescribe medications. You just this is how I think of it, but obviously some other psychiatrists might be different. But I try to. Oh, I'm sorry. There's like a car passing by.
Oh, it doesn't really matter. That happens here all the time. It's just New York. Don't worry.
Yeah, yeah. I thought I would escape that here, but I live right
Yes,
next to a road.
you would think so, right?
Yeah, but it's fine. But yeah, as I was gonna say, my approach would be to like put off prescribing medications as long like if I can. I mean, if I can treat somebody without giving them medications, I'm gonna do that. And medications are like the last resort because in osteopathic medicine, which is what I'm studying, I'm not like, most MDs are allopathic physicians and DOs are osteopathic. So I'm going to be a DO. And we study that like you can treat the body without like prescribing medications just by using like a physical means or like treating the mind, body, and spirit as a whole without like before even trying to add something like from the outside, like a chemical or to induce a chemical change. So yeah, I would try to treat the person as a whole first without before I give them any medications. Yeah.
Okay, two questions. One is I'll hold that for the second part, but the first part is there are two doctors, man and woman, their husbands. They're called Brown,
Mm-hmm.
and I think they're both psychiatrists. He was at Columbia or is at Columbia,
Mm-hmm.
and he prescribes breathing for all his people. He doesn't
Mm-hmm.
prescribe any medications. As he uses breathing techniques to. She does too. As a
Mm-hmm.
matter of fact, he was always into the breathing, but she was a psychiatrist, but believed in the medications until
Mm-hmm.
she got sick and the medications didn't work, and she came back with the breathing techniques, and that's so now she only works with the breathing techniques to bring people back to strong mental health.
Mm-hmm.
And
Yeah,
I'll
that's
I'll research that and try to send you the link on them if you want to check it out.
yeah, that's interesting. I agree. Like what you told me last time when we had a conversation, it really helped me like concentrating on your breathing because it's like your physical health, your physical processes like breathing and the way that it affects the way your heart works. It affects the way that
Yes,
the blood flows to the rest of your body, and that includes your brain. So
yes,
obviously that's how it affects your mental health as well.
yeah, I guess so. And
Mm-hmm.
so then the other question is this: so like, if you do get a post in New York, let's say wherever you get posted for your advanced studies,
Mm-hmm.
they're going to be using chemicals,
Yes.
or is the OD different?
DOs, I
Yeah.
mean, it's pretty the same, pretty much the same, DOs and MDs because we go to the same residency programs. There's no like difference, like they didn't segregate it as they used to. Like I think recently it changed so that they go to the same residency program. So I would probably be like working with MDs and like I would just have an additional specialized skill in osteopathic manipulation treatment, which is something that we learn in addition to like normal medical school as DOs. So we learn how to treat the body with like physical manipulations, using our hands. If they're like, let's say the patient has digestion problems, we manipulate the muscles and nerves that are in the area that innervates the digestive organs, and then we try to heal it without medication. Mhm.
What about acupuncture?
Acupuncture, we don't. I mean, we don't use that in our practice. I think that's different, but I'm pretty sure it's similar. It like, I think I'm not. I don't know much about acupuncture, but doesn't it like improve the blood flow to like certain parts of the body?
Well, the acupuncture is based upon the nervous system.
Mm-hmm.
So if you're as a DO, if you're manipulating, the muscles and the nerves are going to stimulate the muscles. So the principle of acupuncture is put those needles in certain nerve points,
Mm-hmm.
and it recharges the flow to the area that's that's being damaged.
Mm-hmm. Yeah, it's kind of similar to what we
Mhm.
do, but we
Yeah.
have to use our hands. Like we use our hands, and we don't use like needles or any tools. But yeah, it's very similar. And the meaning of osteopathic medicine is like osteo, which is involving the musculoskeletal system.
Okay.
So we like approach a person's health at the like thinking about the musculoskeletal system and how the different body parts and systems are interconnected, including the nervous system.
Oh,
Yeah. Hmm.
okay. So I mean, it's really it gets really pretty deep and thorough, right?
Yeah, it does, and it's really interesting though to like learn about all of this. And in the matter of just a few weeks, I've learned so much, and I feel so smart already. Like when I talk to people about it, even my mom, I tell her about like the spine and the different vertebral levels, and she's impressed. So I'm
Well,
very
that's
proud of
hey,
myself.
you should be, because to impress your mother is pretty good, right?
Yeah. She's
Oh,
very happy that I'm in medical
yes.
school.
I'm happy you're having a good time. That's what counts.
Yeah, thank you so much.
Because I was concerned about just, oh man, how's she doing this, man?
Hmm.
Right. I see you over there posting about flowers. Why aren't you hitting the books?
Yeah, I do. I hit the books, but I also make time for like journaling everything, because like in the end, I want to like have something to look back on. Like I'm gonna be when I finish medical school, I want to have like memories, and I take videos of myself studying, and then I take pictures of the campus on campus, and then I write about it just because I want to have like a record of my life. And I
Okay.
do that no matter what. Yeah.
So,
Mhm.
last time we met was about what, 8 weeks ago?
Yeah, that was before I started medical school. I
Yeah.
believe it was in July at some
Hmm.
point.
Yeah, it was in July.
Yeah.
Right. Maybe we can do another one
Hmm.
whenever,
Maybe.
whenever you're ready, because I have more flexibility than you have.
Yeah, like I would love to do it maybe at the end of my semester.
Okay.
Like yeah,
Oh, yeah.
after I finish this, my end of my quarter. Yeah, after I finish this quarter.
We can have a recap.
Yeah, exactly. And then I can let you know how it all went.
Yeah, and then because you keep these. I send you the clips, right? You got them,
Yes. Uh-huh.
so you can keep them and save them for your I guess your video, whatever you call it.
Yeah, I will definitely save them. I saved some of them, the ones that you sent me, and I like looking back on them like maybe many years later. I'll like listen to them and I'll be like, oh wow,
Yeah,
I've
well, that's true.
changed.
I mean, you don't have to wait that long. You could go back to the one in July and compare yourself to that one to now.
Yeah, exactly. And I remember I was very sad and like
Yeah,
wondering like what I
yeah.
was gonna.
I was like, oh my God, poor baby, how's she gonna do it?
Yeah, and now it just I realize that it's not as bad as I thought it was gonna be. Like it's not like my life is over. Actually, it really made my life better coming to medical school.
Yeah, like because now, I mean, like this is where you belong. Lubna.
Mm-hmm. Mm-hmm.
It's nice to do mental health, but there's a million mental health guys.
Mm-hmm. That's true. And like being a psychiatrist, like having a doctorate degree in osteopathic medicine, I feel like that's very unique in the mental health field. Like because you can
Yeah,
give,
but
yeah,
not only that, it's you. It gives you, it gives you the latitude to live life the way you want to live.
that's true. The freedom, like yeah, I feel that way a lot. Just being in medical school, I feel a lot more free, and I know that right now I'm not financially like independent yet because I have to use loans to pay for all of my tuition. It's a lot of tuition. So, but I know that eventually it's like I'm gonna make a lot more, and I'll be like it's a truth that financial freedom is like a big part of like freedom, and like having that choice of living life the way you want to is such a big plus, and I'm really excited and happy to be able to be on that path towards
Yeah, very
freedom.
commendable.
Yeah.
So you'll be doing work in. You have a private practice. Or you're going to go public, or what are you going to do?
I'm thinking of doing half and half, like working in a private practice, but also having like maybe working with Kaiser Permanente if I live on the West Coast, or Columbia or NYU if I live on the East Coast in New York. And like I would also love to have a private office, like for additional, like maybe half the week I can I'd go into like the main hospitals and like work with the emergency department for psychiatry, and then half of the time I can have my own private practice. Mm-hmm.
So what would it be like working in the emergency psychiatric? I never thought of that.
I have never worked there, but I did take a class on it, and like one of my like there was a class called Field Work in Psychological Services, and one of my classmates in that class was working in a psychiatry emergency room, and she was very like she told us a lot of stories about how it was kind of intense because these people are having like psychotic breaks, and or they have like really crazy issues that aren't visible to you from like just looking at them. So you just have to be careful, and you have to be very clever in the way that you interact with these people. And
Mm-hmm.
yeah, it's very challenging, but I also think it's very interesting, which is why I would love to do that.
So in your private practice, will that be like um, high-end people or just regular folks or insurance claims? What are you going to do?
I'll probably just do regular people because I really like talking to people about their like life problems, and I know a lot of people have depression and anxiety, especially in America. It's a big mental health crisis, so I want to help people deal with those things, and if they need the drugs to help them like live a better life, like antidepressants, I would help prescribe those to them.
All right. Okay.
Yeah.
Well, I know you have a busy schedule. I don't want to keep you away from enjoying the free time you have.
Yeah, no, I was just studying today because I have another exam on Monday. I have an anatomy exam covering the abdomen and all of the digestive organs.
Okay. Well, whatever you say, because I mean, like, you say, those are more, you've taken more exams than I ever want to take in my whole life. So, props to you. So, ladies and gentlemen, that's Miss Lubna Kabir. What's the name of your school again?
Midwestern University, Arizona College of Osteopathic Medicine.
There you go. Now she's at the Midwestern University in Arizona, and she's going to be a DO, and she's going to be, shrinking your head. So, give her all the props you can. And until next time, Lubna, it's been a pleasure as always, and I'm so happy for you. I'm so relieved that you're having a good time.
Thank you so much, William. And I really appreciate you taking the time to speak with me and always keeping up with my journey and all my
Yeah,
adventures. Yeah, I really appreciate it.
my pleasure. Talk to you later. And
Okay.
and regards to your mom now.
Oh, sorry. Oh, regards to my mom. You want me to say hi to my mom for you?
Yeah,
On your...
tell her William said hi, mommy. How you doing?
Okay, I will definitely let her know. Thank
Peace
you
out.
so much. Bye.
Bye.